Good evening and welcome to the April 7th, 2025 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Andrew Chalupka.
Here.
Dan Finn.
Dan Finn here.
Karen Gustowski-Govin.
Karen Gwizdowski-Govin here.
Bill Muller.
Bill Muller here.
Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Let's see. Molly Scannell.
Molly Scannell here.
Devon Thornton.
Yvonne Thornton here.
Kyle O'Connor.
Kyle O'Connor here.
I'd like to open the meeting. May I have a motion to open the meeting?
This is Dan Finn. I'd like to make a motion to open this meeting.
It's Bill Muller. Let's second that motion.
All in favor?
Dan Finn, aye.
Bill Muller, aye.
Andrew Chalupka, aye.
Karen Gwizdowski-Govin, aye.
Jen Maynard, aye. All right, this open meeting of the Grafton Board of Health is being conducted hybrid, consistent with the act extending certain COVID-19 measures adopted during the state of emergency. Governor Healy has further extended this act until June 30th, 2027, of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted on the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. If the public has a question or comment on an agenda item, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. For this meeting, Grafton Board of Health is convening by video conference via Zoom and in person, as posted on the town's website identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Any supporting materials that have been provided to members of the body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, question, or motions. Please identify yourself by your name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes and any motions made during the meeting will be conducted by roll call vote. I feel like it's longer in person. All right. Thanks for that, everyone, and welcome, Nikki. We recognize you're here. All right. So, Alliance team, we were thinking that you all would go through with your updates, and then we'll have Kyle give his. Does that work? All right. So, Molly, do you want to take it away?
I'd be happy to.
Great.
So good news, COVID numbers have significantly decreased with one reported case in Grafton in March versus the 10 that were reported in February. And again, this is just reported with PCR testing at like doctor's offices, things like that, not home tests, of course. This significant decrease is true for seasonal flu numbers as well. With 27 reported cases of flu in Grafton for March, which is significantly less than 104 cases that were reported in February. This decrease is expected as we are coming out of flu season with the coming of spring. We still have no reported cases of pertussis since December 2024. For town updates, DA presentations will start this month, with the first being next Tuesday and on April 15th at the Grafton Senior Center. And again, that first topic is scams targeting seniors. Blood pressure and file of life clinics continue every first and third Thursday of the month at the Grafton Senior Center. I saw 17 seniors at the March 6th clinic, and the March 20th clinic was unfortunately canceled due to a scheduling conflict. For in the news, national and global, so measles. As of April 3rd, 2025, the CDC reports 607 confirmed measles cases this year, surpassing the 285 cases reported in all of 2024. So that's a big jump for this year, and it's only April. Most cases do involve unvaccinated individuals. Outside of Texas, New Mexico, and Kansas, where there are confirmed outbreaks, the CDC has reported between 1 and 9 measles cases in states across the US, including Alaska, California, Colorado, Florida, Georgia, Kentucky, Maryland, Michigan, Minnesota, New Jersey, New York City, and New York State. They count them separately. Ohio, Oklahoma, Pennsylvania, Rhode Island, Tennessee, Vermont, and Washington. Health Secretary Robert F. Kennedy Jr. has highlighted vitamin A, budesonide, and clarithromycin as showing good results in treating the symptoms associated with measles. While the CDC acknowledges vitamin A as a treatment option, it is emphasized that vaccination is the most effective defense against measles infection. Reports of vitamin A toxicity in children highlights the dangers of excessive supplementation without proper supervision. That's like in a hospital setting. The MMR vaccine, typically administered in childhood, offers long-term or lifelong immunity and is highly effective, providing 97% protection with the recommended 2 doses and 93% with only the 1 dose. Adults unsure of their vaccination status or those vaccinated early with a less effective version. So that's before 1968, they had a different concoction of the vaccine. Those individuals are advised to get revaccinated if they can. For bird flu, as of April 4th, 2025, the CDC has reported 70 confirmed human cases of bird flu since the outbreak began in 2024, with 1 human death confirmed. Even with the cases that are reported in wild birds, the risk to humans in Massachusetts still remains low. The virus has only spread from animals to human at this point, and there is no reported human-to-human transmission still. Bird flu is being monitored through a combination of advanced technologies and public health strategies, including biosensors that can detect the virus in the air, wastewater monitoring as an early warning system, virologic surveillance, tracking influenza-like illnesses, and animal monitoring by public health systems. These efforts are intended to detect and contain outbreaks early before, it gets out of hand. It has been reported that bird flu has also been infecting wild and domestic cats. Though the overall risk to indoor cats still remains low, feline cases are typically severe and often fatal and are often linked to exposure to infected birds, raw poultry, or unpasteurized dairy products. To minimize risk, experts recommend keeping cats indoors, avoiding raw diets, and ensuring proper hygiene when handling raw meat. While there is no evidence of transmission from cats to humans, with recent strains, the situation is being closely monitored. Bird flu has had a significant impact on agriculture, particularly in the poultry industry, in terms of loss of livestock and economic consequences from disrupted supply chains. It is also affecting the dairy industry, with a decrease in milk production, trade, and market challenges overseas. Despite these challenges, efforts are underway to mitigate the impact, including research into vaccines and improved biosecurity measures. Recent updates on bird flu vaccines highlight significant progress and challenges. For human vaccines, the FDA has approved 3 bird flu vaccines for humans, which are stockpiled for emergency use, and these won't be used unless there's an outbreak. These vaccines are not yet available to the general public, but are ready for deployment in case of a health crisis. The poultry vaccines, the USDA has conditionally approved an updated avian flu vaccine for poultry, aiming to curb the spread among birds. And then mRNA vaccine development. The Department of Health and Human Services has allocated $590 million to Moderna to fast track the development of an mRNA-based bird flu vaccine. This technology promises quicker production and easier updates compared to traditional vaccines. In terms of challenges, scientists warn that the H5N1 virus is mutating rapidly, potentially reducing the effectiveness of existing vaccines. Research is ongoing to develop formulations that can address these evolving strains. So, symptoms in humans. Bird flu symptoms are similar to seasonal influenza symptoms. For mild illness, it includes cough, sore throat, eye redness or eye discharge, such as conjunctivitis, fever, runny nose, fatigue, myalgia, joint pain, and headache. For moderate to severe illness, shortness of breath or difficulty breathing, altered mental status, and seizure. Complications can include pneumonia, respiratory failure, acute respiratory distress syndrome, multi-organ failure, specifically respiratory and kidney failure, sepsis, and meningoencephalitis. For prevention and reporting, so it's suggested to not touch or consume raw milk or raw milk products, especially from animals with confirmed or suspected bird flu virus infection. The public should report observations of sick or deceased wild birds, poultry, and domestic birds to animal control. If a dead bird is on someone's personal property, they are responsible for disposing of it. If there is a dead bird in a public way, then animal control would be responsible for picking it up. If there are 5 or more birds in one location, it should be reported to the state via their online site. And I have this link. I don't know if I should put it in the chat or if it's best to email, but I don't think it's helpful for me to read the link.
If you want to email it to us, we can have it put on the website and on
Yeah.
minutes. Yeah. Thank
So
you.
it's that's if there's a group of 5 or more dead birds, you report it in this way to the state and then they take care of it and investigate.
Great.
Livestock and poultry. Since wild migratory birds are natural carriers of bird flu, preventing wild birds from mixing with or having contact with domestic flocks is essential for disease control and prevention. So I'll write that in an email with that link,
Perfect.
just so everyone has it.
Great.
Any questions?
Gee, that's it, Molly?
Yeah, I know the bird flu is a lot. It's like
important
there was a lot of
topic
new
right now.
information.
What questions, if any, do folks have for Molly?
Is there any guidance for individuals for disposing of the bird safely if it's on their own property?
It's just not to touch it. It's like contact precautions, wear gloves, things like that.
Okay.
Yeah.
So disposable gloves, or if you're using your, even if you're using your garden gloves, you probably want to wash your garden gloves afterwards. If you
Yeah. Definitely wash your hands
scooper
after.
or a shovel or something like that. Best to, use that. Question. And kind of a silly question. Vaccines for bird flu. I'm assuming we're talking about human vaccines, but is there something that being in development for birds, or at least for birds that are,
Yeah. They have developed a poultry vaccine. It hasn't been issued yet, but it's been they're developing it right now, and it's to prevent spread among
Yeah.
domestic birds.
That's
So I'm assuming that's like poultry farms, things like that.
Great.
And maybe pet birds.
yeah. Well, if they're susceptible, certainly. Yeah.
Yeah.
Anything else for Molly? Great. Thank you. Devon.
I would like to start by apologizing to the chair and the board. I usually get the data that I will be reporting from the admins ahead of the meeting. I hadn't received it. I don't know if you did, but if you have received it, if there's any questions about any of the complaints or any of the food inspections. I'd be happy to answer any.
We didn't get a report this time,
Okay.
so that's okay. You don't have to start your start your report with apology. But could you just summarize for us, what you've done in the last month or so, and any of the complaints? Just a quick summary of what you've seen. Any repeats?
Okay, so just complaints.
Complaints, and then how many inspections you were able to
Um,
complete.
Inspections, I at least 10 inspections since our last meeting. Complaints, I had about 5 complaints actually. Um, 2 food complaints that were unfounded. A complaint from one of the convenience store establishments. It's been addressed. Dan brought it to my attention. It's been addressed, and there was one complaint about um, some nuisance at a property. It was unfounded as well, or it was just taken care of before I was able to find anything. And that was all so far.
Any for complaints in particular? Any repeat locations?
There was just one repeat location, but it was across the street actually from a location, and it was a vacant lot.
Okay.
Yes.
So typically we'll get a report of all the food inspections Devon has done, Title V inspections, and also any complaints that were called into the Board of Health that he's then investigated, and sort of the status of what those things are. Any questions on the summary? Or
Thank you.
we'll see that report, and if we have anything for next month, we'll add Devon. Thank you.
And I do apologize.
No worries. Nikki, did you have anything?
I do not.
All right. Thank you. Before I turn it over to Kyle to share his screen, I apologize. I should have done this in the beginning. We do have a new member of our Board of Health here. And I don't know if you want to say a few words and introduce yourself, not to put you on the spot, but welcome. We're happy you're here.
Thank you very much. And my name's Andrew Chalupka, and this is my first meeting. I'm a lifelong resident of Grafton, and I appreciate hearing from the members of the Alliance. I know you guys do a lot of great work on our behalf and to help the town, so thank you.
Great. Welcome.
Yep, welcome, Andrew.
Thank you.
All right.
Nice to meet you.
Thank you very much.
All right. Kyle's going to share his screen and take it away for us.
Hopefully.
Hopefully. We'll go through the rest of the committees after. Perfect.
Okay. So thank you, Chair, and to the board. My name's Kyle O'Connor. I'm from the City of Worcester Division of Public Health. I'm the Tobacco Prevention Specialist, and I work with the Alliance. So I work with the town of Grafton, just to kind of go over some of my enforcement and then regulatory aspects of the thing. So I'm glad that this is your first meeting, so you can kind of get an overview of the tobacco regulations, and then I can provide an update to the inspections that I did last month. So that's basically the overview of the presentation. I'm going to review the regulations, discuss some compliance and enforcement, recent trends, provide an update on my retail education visits, and give you folks an opportunity to have any questions if you have any. So, permits and restriction requirements for the sale of tobacco in the town of Grafton. Tobacco sale permits are non-transferable, which means if an establishment changes ownership or if the new owner decides to move locations, they would be required to apply for a new permit, as the permits are issued to the individual and also to the address. In the town of Grafton, the regulations state you have a maximum of 12 permits allowed. Currently, there are 9 active permits, so you still have some available. No permit shall be issued within 500 feet of a school, and no new adult-only tobacco store shall be located within 25 feet of an existing retailer. Smoking bars are also prohibited in the town of Grafton. Permit renewal. So, like I said, there are permits available. Each permit is a responsibility and renewal of the town of Grafton and the Board of Health. Tobacco sale applications are found on your website and then are turned into your administrative office. If a new retailer were to sell to a minor 3 times within a previous year, the permit would not be renewed. If a retailer has failed to pay any outstanding fines, that tobacco sales permit would also not be renewed. Now I'm going to get into some products and sales restrictions. So flavored products are prohibited. This aligns with the state law in Massachusetts, as well as any tobacco product flavor enhancers. The enhancers aspect of the regulation is a local regulation to the town of Grafton. What I mean by flavored tobacco products, we're talking about things like vapes, disposable vapes. You're seeing flavors in that were really popular in 2019 and 2020, but that has since been banned, as it shows if youth aren't allowed to get these flavored products, they likely aren't to use those tobacco products. So that was the kind of point of the regulation, and we have seen a decrease in usage, so it has proven effective. Blunt wraps are also prohibited. Non-residential wear-your-own machines are prohibited. Self-service displays, vending machines are all prohibited, and this aligns with most other municipalities in Massachusetts. And tobacco sales permits are prohibited in educational and healthcare institutions. Nicotine pricing and restrictions. So electronic nicotine devices shall not exceed 35 milligrams per milliliter of nicotine content, and this basically bans 5% vapes. So in all your retailers, no retailer should be carrying a vape that is above 3.5% nicotine, unless it's an adult-only retail store, so like a smoke shop. They are permitted to have 5% nicotine vapes. However, still no flavors are allowed. Only tobacco, Virginia tobacco, or clear are allowed. And then cigar pricing, that is also a local Grafton regulation. $2.90 for a single cigar is the minimum, and then for a 2-pack or more, it has to be at least $5.80. Compliance and enforcement. So my goal for all towns in the Alliance is to visit each establishment 3 times. The first visit is a retail education visit, which I just completed last month. That's when I go in, introduce myself as the tobacco compliance officer. I review the regulations with the owner or manager, whoever's on staff. I give them a copy of the regulations, my business card, and I'm available for any questions that they have. And if I do see things that are not in compliance with the regulations, I point it out, I give them a chance to correct it while I'm there, and then next time I would visit, if those things were not fixed, that's when I would do the citation and fine structure, which I'll go over in the next slide. Some common violations I see, the most serious ones are selling to minors and the selling of flavored products. Those are both state regulations, and those violations have a pretty steep structure. Again, next slide I'll show you that. Some violations that don't always occur to a citation are improper signage or incorrect minimum cigar pricing. That's something that's usually the establishment doesn't know that they're in violation of, and they do want to correct it. And I do carry around a big accordion folder for all my signages, so those are provided to retailers at no cost. So this is the fines and penalty structure. A state violation, like I said, is a flavored product or a sale to a minor, for an example. First violation is $1,000. Second violation is $2,000 with a 7-day suspension. Third violation is a $5,000 fine with a 30-day suspension. And those all would go before the Board of Health as well. Some local violations. First violation is a $300 fine, excuse me. Second violation is a $300 fine plus a 7-day suspension. Third, $300 fine plus a 30-day suspension. And then the fourth time, the board would likely revoke their permit permanently. But that's, of course, again, to the board. So this is an update specifically on the retail education visits I did with your establishments last month. Out of your 9 tobacco retailers, all were visited for the inspection. 43 Main Street was still under construction, so I could not visit that store at that time. And then 215 Worcester Street appeared to be permanently closed. There was no products or any type of anything in that store, including food or anything like that. I let Nancy Connors know about this, and she will follow up with the permit holder to kind of check in with them to see where they're at. And like I said earlier, each retailer was given a copy of the state and local tobacco regulations, a brief overview of those regulations, my contact information, and any additional signage needed. And these are just some of the emerging trends and challenges that I've been facing. So an increase in youth vaping all across the country, not just in the town of Grafton and the state of Massachusetts, especially with disposable brands like Elf Bar, Crave, and Flume. These are things that the youth can get their hands on pretty easily, unfortunately, and then just discard. There's also been an increase in youth using oral nicotine pouches like Zyn. Those are currently being looked at by the state, and if I do have any more information on those, I'll of course provide that to you as well. And then, of course, online sales and social media make enforcement difficult, and the trends of smoking and vaping are unfortunately still present, but the Division of Public Health is actively working on prevention and education materials to combat that. And if there are any new potential policy enhancements to address new products or enforcement gaps, I'll be looking at those as well and bringing those to the board. And if you folks have any questions for me or concerns, I'm happy to answer them at this time.
Dan?
Thanks, this is Dan, and Kyle, thank you. I do have a couple of questions about the permit itself. Is it a state permit that's issued by the town, and is it renewable each year?
That's a good question. So, tobacco retailers, the first step for them is to get the DOR permits, the Department of Revenue permits from the state. That allows them to purchase the tobacco products from the distributor, and then the local Grafton tobacco permit allows them to sell those products in the town of Grafton. I'm not exactly sure on the process of the town of Grafton's renewal and application process, but for Worcester, they do have to present the 3 types of DOR permits: sale of tobacco, sale of cigarettes, and sale of electronic nicotine devices, which are vapes. They have to present those 3 documents to us. We go through that process. So I do an inspection, and then they receive the the local regulation that allows them to sell.
Thanks, thank you.
When you have a violation, there's a different fine for the town than there is for the state. How do you reconcile that?
That's a good question. So, like I said, the state violations are a bit more concerning and a bit more serious, I would say, for lack of a better term. Selling to minors is something that we take very seriously. We don't want any tobacco products to be in the hands of the youth. And also the flavor ban is a big issue for us as well. We have sometimes establishments who get them from out of the state or from, distributors who aren't permitted to provide those products to establishments in the state of Massachusetts, and then they kind of sell them under the table. Haven't had any experiences like those in the town of Grafton yet, but when I do those compliance checks with youths, after I complete those, I'll come back to the board with an update on how those go. But going back to this fining structure, so depending on the situation, if a violation were to occur, I would usually refer to the state higher fine and suspension structure. It usually has a better way of deterring retailers from continuing violating the regulation.
Follow up on that? You good?
It's a lot to throw at you, so if you ever have any more questions, I can leave my contact info, or I can always come back to another
But
board.
since there's a state fine, why do we even have a local fine?
Because you have regulations that are permitted only for the town of Grafton. The best example I can think of is your cigar minimum pricing.
Yeah.
Each of the Alliance towns have a slightly different cigar pricing minimum, so that would be an example of where I'd only fine them for a local violation.
But selling to a minor would be a major violation.
Yes,
and
that would be.
a state fine.
Correct.
So you would come with recommendations to us as to how to apply.
Yep, a lot of my work right now is involving enforcement and making sure I complete my goal of meeting all of those retailers with 3 times in a year. But I do try to make time for looking at policies and regulations of other municipalities that are, more updated, have more updated regulations that I can then implement into the Alliance towns or Worcester.
And Kyle, 3 times a year, that was one of my questions. Unless there's a complaint, maybe you may go another time.
Exactly.
And I assume the others are unannounced.
Correct. Yes. So this is for Worcester. I'm sure it pertains to the town of Grafton as well. If the town were to give an establishment a permit, somewhere in the regulations it says they are, as you're doing business with the town of Grafton and we're allowing them to have a tobacco permit, they are open to any type of inspection at any time.
Thanks.
And all of my inspections are unannounced.
So to Dan's point, I was going to ask the same thing. So the first one is to sort of introduce everything. That's one time or every year?
I do that My goal would be to do that once a year.
Okay.
Next year, if it's the same owner, it's the same establishment, I would give them less leniency because I did go over the regulations with them and they have copies of everything.
Yeah.
So that's when I would treat it more as a follow-up or a enforcement regulation as opposed to an education visit.
And the other two visits are more like secret shopper surveillance. We've
Correct.
heard of those.
Yes,
Here.
the one the youth compliance check is when we hire youth interns to come with me and I send them into the store. They come out either with or without a product, and then we follow up with them with the violation if that were to occur. And then the third type of inspection is just a general enforcement inspection, is where I go in myself and I check basically all the things I check on my retail education visit, except this time they know what I'm looking for, I know what I'm looking for, and if I do see any violations, that's when I would issue a citation.
And as if any law changes or requirements throughout the year, you're going and doing in-person education to them as well.
Yeah, so if there are any state or local amendments to regulations, the board would be notified, and then all establishments would be notified, and then they would be given a couple weeks to amend their store to meet those new regulations, and then I would follow up with the visit to make sure that they're compliant.
Just so you know, for this board at least, we have found it helpful if there is a violation to understand, has there historically, because we don't always remember if it's the same location or not, historically, if they've had, a violation, what was it, what action did we take? And also what has been helpful is if they happen to also own in the same regions of us, but outside of town. Just tells us whether or not they are new to the business and they're just sort of getting to know things, or if they know and they're sort of not really enforcing those things. So those things are helpful, I think, when you come to us with things. Not that you're going to find anything, but if you do find anything, so we know.
Yeah, any type of any type of violation, I would immediately report that to Nancy Connors, and then I work with her to issue that citation, because that citation would come from the town of Grafton and not the city of Worcester. So I work with her very closely if I do find anything.
Great.
Yep.
Karen, any questions on the phone? I don't want to forget that you're there.
Not that I can think of.
All right. Good. All right.
Appreciate the re-education.
Yes.
You've been doing this so long. It's like thankfully, knock on wood, we don't really get many violations. Not that we have a lot of permits either, but still, we don't get a lot of violations. So it's, we don't talk about it frequently, we'll say. It's not like an every month or even every 3+ month type of topic, unless we're talking about potential updates or there happens to be that random violation that crops up that we have to discuss.
So we might need re-education if something does come
Of
up
course.
as well.
Just let me know when I'm available.
Perfect.
Anytime to come to one of these meetings and help out.
Very good.
Thank you, Kyle.
Thank you. All right. Moving right along. Dan and Bill and others, any updates on the opioid settlement funds?
Yeah, we had a meeting on the 25th, and we actually had a final presentation from the GAP group, and we took a vote and accepted their proposal and sent it to Evan, who was working on, he and Mary are working on a grant, formal grant, so that's good. And then we're hoping to schedule a couple more Narcan trainings in the near future as well. So,
Yeah, we're hearing from another group. Schools and things like that are likely going to want that training as well. So,
right.
Yeah.
Yeah.
Great. Anything else, Bill?
Well, we did enter into this without the other two alliance towns.
Right.
I think, a number of reasons for that. One is the GAP organization already has an establishment in our midst. They're optimistic that Shrewsbury may participate as well. But West Boylston
Yeah.
is
It's probably not going to in the near future.
right. I think they have had some unsettling things in the town and so forth. I don't think they're ready to kind of commit to this.
Okay.
It does replace some funding that they had from the Worcester
Yeah, the district attorney's.
District Attorney's Office
That's
that had basically not been renewed. So actually, it's an existing program that had existing funding. That funding had not been continued, so our proposal would basically take the place of the funding they had lost.
Yeah, and make sure there's no loss of access then. That's good.
Yep.
Great. Nice. All right, thank you. And you
And-
guys are meeting again, or?
Andrew did join us as well.
Oh, yes.
Oh, you did? Okay.
And he has particular expertise as an anesthesiologist.
Yeah, yeah.
With opioids.
Yeah, I think it might have been the same day that Andrew got sworn in, which was
Yeah.
pretty nice. And he's welcome, he's gonna be on the committees, volunteer to do that, which is great.
Great. And you're at your max for that committee, because if you have anybody else, then you're then you're subject to open meeting law.
Okay,
So there you
I
go.
believe that's once you have enough voting members or something, we have to
Yeah.
do all the things, yeah. Okay, great, that's a great.
We'll have the
update.
police chief.
Yeah.
Yep.
I'm going to rearrange just a little bit to put the subcommittees together. So we had Todd come and speak to us, I think it was last month. It's all a blur now. About some findings. He is on the ambulance committee and was starting to do a report for the town of Grafton on AEDs and first aid kits around the different municipal buildings and schools here in town. Additionally, the number of ambulance calls and kind of repeat places and what that's looking like for the town budget, but also just the ability of the ambulance to be as responsive to some of those things. So we had our first meeting. Andrew's going to join us as well at the next meeting. Our next meeting is going to be April 16th, which is exactly a month from our first meeting. The reason why we're going to have to do a little bit more work when we went through the report. We did find that there's a little bit of gaps in what information we were able to obtain, so we really need to figure out, one, a baseline of all of the places that we're looking at and what everybody has now. And so Todd did a really good job starting that work. This coming meeting, it's going to be more of a working meeting to sort of assign people to go and do some follow-up. We do have Amelia on that committee, Marianne from the police department, Eric from the fire department, Mike Mullen from the Alliance, who has done this type of work across Worcester, and then the two of us from the board. We will also have Greg from the ambulance vendor as well join us thereafter. So the plan is to sort of get a foundation baseline of what we have and then make a recommendation for what we need, and then be able to bring that back to Evan as well as educate all the different stakeholders. Everybody is sort of doing their own thing or not doing much. And of course that runs the risk of when somebody needs an AED, not having access to an AED, when somebody needs first aid, not having access to it. And then of course different groups are using different funds to be able to have something in place. And so we really think for safety and efficiency, it would be good to have sort of a uniform contract. There are some groups that are doing a pretty robust review of all of this and have processes in place. But not everybody does. So we definitely need to do some education in different groups as well as to, why we're doing this, why we need an accountable party at each location. Sort of like a little mini hospital on wheels. So, but there are quite a few municipal buildings, outside of this building. And even in this building, we want to make sure everybody has what they need. So we don't anticipate it being a subcommittee that needs to exist forever, but we need a few space to get organized, make a proposal to Evan, do an education plan, and then likely we'll be attaching something to when people are getting their permits and renewals and things like that, so that Nancy can just kind of confirm that they have everything in place and we don't kind of let it fall to the wayside. So yeah, so
Great.
lots of work to do, but should be good, and we have a good group to do it. And Mike Mullen from the Alliance has a really robust structure already from Worcester, so we're probably going to kind of take that and start to plug that in for us as well. So we'll bring back updates to you all. Do you have anything on the rabies clinic you wanted to share?
Just that it's coming up this Saturday,
Thought so.
and that it's a full slate
Yes.
of appointments. There will be 3 veterinarians. I'm gonna be there from 9 to 11 just to help out a little bit.
Yeah.
Open doors, pet dogs and cats. Maybe not so much the cats.
Maybe some cats like to be pet.
And so yeah, we're excited about getting a lot of participation from the town
Yeah.
people.
Yeah. And so volunteers are the vets for the weekend. So mission critical that if folks signed up for a slot to please show up so that they want to do this year over year for us, because this is actually probably one of our bigger clinics too, since we had a little time to
Yep.
to socialize it. So
Yep.
nicely done getting that organized again.
Yep.
All right. Then we have a few nominations, keeping on the the animal side, for animal inspectors. And so the names are listed here on our agenda. Has Keith been doing this? I think everybody's renewals
Yeah.
for the coming year.
Yeah, I think they are reappointments.
Yeah, so we just need nominations for each of them for a 1-year term.
Okay, this is Dan Finn, and I believe these nominations go to Evan or the select board, and they actually appoint them if I'm correct. So I would like to make a motion to nominate Melinda McKendrick as animal inspector for the town of Grafton.
This is Bill Muller. I'll second that nomination.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Andrew Chalupka, aye.
Karen Gostowski, Govan, aye.
Jen Maynard, aye.
I might as well go.
Yeah, Mr. Finn, take it away.
On a roll, since I have him here in front of me for a change. So Dan Finn, I'd like to make a motion to nominate Jay Husson as animal inspector for this coming year.
This is Bill Muller. I second that nomination.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Andrew Chalupka, aye.
Karen Gostowski, Govan, aye.
Jen Maynard, aye.
And lastly on the list, this is Dan Finn, I'd like to make a motion to nominate Keith Elms as assistant animal inspector for the coming year.
This is Bill Muller. I second that nomination.
Dan Finn, aye.
Bill Muller, aye.
Andrew Chalupka, aye.
Karen Gostowski, Govan, aye.
Jen Maynard, aye. I don't even have to say the words anymore by the time we get to the third one. I should, but thank you. All right. Then we do have a couple of minutes meeting minutes to approve. It's from our last month's meeting and then the meeting where we had all of us join the select board meeting. So first is March 3rd.
I don't know, I don't have that in front of me. Maybe I can dig it up. Oh, there we go. Yep, this is, actually, I've got February 4th, March 3rd, you have? Okay. This is Dan Finn. I'd like to make a motion to accept the minutes of the Grafton Board of Health for March 3rd as presented.
Is there a
This is Bill Muller. I second that proposal.
second? Roll call.
Dan Finn, aye.
Bill Muller, aye.
Andrew Chalupka, abstain.
Karen Gostowski, Govan, aye.
Jen Maynard, aye. And the March 4th, which was our visit to the select board.
Yep, this is Dan Finn. I'd like to make a motion to accept the brief minutes of February 4th, 2025 of the Board of Health.
This is Bill Muller. I second that motion.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Andrew
you-
Chalupka, abstain. Sorry.
Sorry. Dan, did you say February 4th? It was March 4th.
I think you said March 4th.
He said March 4th.
Okay.
Yep.
I thought I heard February. Before we get through the roll call and have to redo the world.
Right. March 4th.
Do you have a vote, Miss Govin? Miss Govin?
Karen Gostowski, Govan, aye.
Jen Maynard, aye. All right, thank you for that. All right, so we do have to discuss for upcoming meetings. As I mentioned in my very lengthy introduction this earlier, there is an extension to Governor Baker's provision to June 30th, 2027, where we are permitted to have hybrid or virtual meeting. I believe that's what the order is that we can extend as we have been. If we do hybrid meetings, we do have to have a quorum in the room, is our understanding. So at least 3 of us need to be in the room. Is there a preference to doing full remote, hybrid? I'm assuming not full in person because I know that's difficult for folks. Is there a preference?
I think hybrid makes sense.
Yeah, I think hybrids.
Karen, hybrid work for you?
It does. Most likely I'll be remote most of the time, just based on work schedule.
And typically what we've done is, if Nancy's pretty good about, if people know a little earlier on that it's not going to work for them coming up to that meeting to come in person, and you don't think, there's going to be 3 of us, if we give her a heads up, she can repost it as a remote meeting. So we don't have to we can adjust it as long as there's enough time before she posts the agenda. But we'll stick with hybrid. I believe Nancy's gone ahead and booked the conference room for us, and we did last meeting get through December with our meeting dates. They're just not reflected on this agenda. So our next meeting at this point is scheduled for May 5th. We'll plan for that to be hybrid. Are there any other May 5th, and we will have a hearing at that one, I believe, right?
Yep.
All right, so we'll have a hearing. We'll have lots of reading to do before then.
Is that the well?
Yes, the well. That's the well hearing. So they need to put public notice and things out first.
No, I'm a butter. Does that,
Oh.
does that make me, do I have to?
As a conflict, you might want to abstain from voting. You could certainly ask questions though, or give us questions to ask on your behalf if you're more comfortable.
Right.
Yeah.
I'm gonna have to abstain as
Oh,
well.
for crying out loud. Karen, don't be absent.
Right.
Don't be absent, Andrew.
Can't guarantee until, as long as there's no crisis at work.
Yeah.
Bill and I will have to excuse ourselves
Okay,
and
that's
step
right.
out and have a cigarette break.
Yeah, yeah.
Okay.
50 feet away from the
50
building.
feet. Good that we have this though now, so that we all know and we can make sure to be here. But there are, if you haven't received them yet, there are regulations, and Nancy has some documentation for us to be able to look at. We can forward to, she sent them recently. Is there any other old or new business? I don't know of any other correspondence besides that one. Go ahead, Dan.
I just wanted to mention one thing. Last Thursday, I attended a FEP meeting up in Worcester, which is a public health emergency planning group, and it was a big crowd, probably 50 people, which was amazing. And so we're going to be getting a couple of stop the bleed kits for
Great.
emergencies if we have to do either a dispensing site or whatever. So Nancy had requested those, and they were approved.
Oh, great. That's another hot item for the ambulance committee, the tourniquets and
Right.
training on that stuff.
Right.
So, yeah. Great.
That's it.
And I think a few of us are attending. The Alliance has some training for members of boards of health, and a few of us are planning on attending one of those in the next month or 2. So that'd be good. All right. All right, anything else? Mr. Finn.
I understand there's a basketball game tonight,
He always keeps us on task.
and I think there's a recording of White Lotus, so I don't know if I'll watch it, but in any event,
Well, the meetings are getting shorter as my tenure goes on, so.
I would like to make a motion to close this meeting.
Is there a second?
I'll second that motion.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Andrew Chalupka, aye.
Karen Gustowski, Govan, aye.
Jen Maynard, aye. Thank you, everyone. Have a lovely evening. Stay warm. Hope for warmer, drier weather soon.
Yep.
Take care. We'll see you next month.
Bye.
Thank you.
Thank you. Bye-bye.
Bye.
Bye. Yay. You made it through your first one.